Canadian Blood Services. It's in you to give.
It's in you to give. For years, a message Canadians heard often on TV and the radio calling on people to give blood or plasma. But for gay men and those who identify as men who have sex with men, the practice is out of reach. Through 5 decades, Canada has been restricting donations from this group.
You feel like you're powerless, that you're worthless.
In 2016, a Brampton, Ontario clinic told Christopher Karras he couldn't donate, even though test results showed his blood was safe. That experience led him to file a complaint with the Canadian Human Rights Commission. A federal court is expected to hear his case before the end of May.
When they refused my blood, I thought to myself, what value do I have? Do I have any value? How am I supposed to contribute?
Canada first banned gay men from donating blood in the 80s, after thousands of people were infected with HIV or hepatitis C traced to poorly screened blood from high-risk populations. The ban was upheld for nearly 30 years, even surviving a Charter of Rights and Freedoms challenge in 2010 when the Ontario Superior Court ruled it was not discriminatory. But 3 years later, Health Canada announced a change to the policy, allowing gay men to donate blood if their last sexual contact with another man was not within the last 5 years. During the 2015 election campaign, the Justin Trudeau Liberals promised to remove the policy entirely. Since then, Health Canada approved more revisions from 5 years to where it stands now at 3 months. And the Liberals made another election promise, but the restrictions remain. Nathan Lachowski at the University of Victoria says the deferral was put in place to ensure a safe blood supply, but there are issues.
But it's not really about the time frame. It's about the fact that it's any man having any kind of sex with another man. I think what we do know from decades of research is that that is too broad.
Lachowski, like other critics, says the system needs to be re-examined.
This is a voluntary blood system, and so we need people to feel excited and invited to donate blood. And some communities have been excluded from that, and there's a number of people within them who are really keen to donate and who could be completely safe donors.
The Liberal government says it considers the ban on blood donations from men who have sex with men discriminatory. At the same time, it's also trying to stop the upcoming legal court challenge.
It's hypocrisy, and it's unfortunate because all we want is an inquiry into this, and they're blocking that. They don't want to. They don't want the tough questions to be asked.
The government argues it has no power to change the donor criteria established by Canadian Blood Services. But while CBS and Héma-Québec are the country's blood authorities, it's Health Canada who must approve revisions to who can donate. CBS says it tests every donation, but there is still a window period after infection, but before the virus is detectable. Advocates have pushed for a change to ask donors about any high-risk sexual behavior instead of who they had sex with. Health Canada has confirmed to Global News that CBS has asked for a similar plan involving plasma to be approved. But Karras says such a move is not enough.
With all this pressure mounting for the government to eliminate this policy, this is going to be another attempt by them to appease us and to set this issue aside so that it's something they don't have to deal with.
Both Health Canada and CBS say if approved, the project would add to others already underway that could result in further changes. Karras says he just wants to see a more equal system and an end to what he sees as a double standard. Sean Previl, Global News.